I wish that I could say, please stop making this sound that these people are experiencing, but what we can't do is stop it. But what we can do is give the brain a better pathway of response.
Kind of walk us through like the treatments that are out there right now for tinnitus.
Sure, so in general, kind of global treatments that are fairly recognized are combinations of sound therapy and then cognitive behavioral therapy are going to be your kind of most tried and true. Sound therapy is a pretty wide spectrum though, which can be both a good answer and a bad answer, and so that's where it's really going to come down to each individual patient. That could be as simple as maybe they have an unidentified hearing loss and we need to identify and correct the loss. It could be that they have absolutely no hearing loss and maybe we're only going to focus on positive sound introduction and enrichment. Sometimes it's a combination of using like a cognitive behavioral therapy in addition to tinnitus management. And then in the last 2 years in the US, we've had access to, as you know, bimodal neuromodulation. Advantages with that is we are utilizing both sound, but then also tongue tip stimulation, which has been quite remarkable in terms of outcomes. And so our previously successful sound therapy only approaches have just incrementally become that much more successful with the addition of the bimodal neuromodulation.
Yeah, I know. And you know, one of the things people always kind of panic a little bit when we're like, tongue tip stimulation, what do you mean? Yeah, so tell us a little bit about what that feels like.
So with the linear device, they use 32 electrodes on the tongue. I describe it as like fizzy champagne bubbles or like a soda water, just kind of tickly tingly. It shouldn't be sharp, it shouldn't be painful, but it is a little strange at first. And so what that's doing is it's kind of engaging multiple parts of your brain. So we've got headphones on our ears, we've got the tongue tip stimulator on our tongue, and they're in sync. So more stimulation, more tingly, less stimulation, less tingly. It's kind of creating this ebbing and flowing and sensation. And what we're working on is that neuromodulation half, so redirecting or retraining the brain's awareness of the tinnitus. So I wish that I could say, please stop making this sound that these people are experiencing, but what we can't do is stop it. But what we can do is give the brain a better pathway of response. And so no different than you and I both today, we have kind of a collar on our shirts. We haven't thought about that. It's there, it doesn't matter, it doesn't mean anything until I point it out and you're like, oh yeah, I do.
I feel that,
Because our brain knows it's not important, but it's present. So similar to that, they can still be experiencing tinnitus, but if their brain can learn to recognize that it's not important, it doesn't matter that the signal is still present because their brain has learned that full wraparound. And so when we're working through it, regardless of doing bimodal or doing a different technique, it's not that we're stopping the tinnitus from occurring, but we are learning and helping and teaching the brain to not respond back to a signal that really doesn't need to have value in the situation.
Yeah, that's perfect. Yeah, thank you so much. I appreciate it.